Hi guys, Dr. Pelto here. I'm going to talk a little bit today about shoe selection and how this can help you avoid foot injury. I would say on a weekly basis, I'm instructing 10 or 15 people about shoe choice because you don't realize how the shoe choice can really cause foot pain, foot injury, and foot problems. A few things that can happen if you have the wrong type of shoe or something on your foot. You could injure your toenail. I've had people that have the nails kind of come off because of wearing flip flops. I've had people that get ankle sprains, they get foot fractures, they get stress fractures, and a lot of other types of things. So I'm going to go over a few of my common tips for you. My first tip is to wear a newer shoe instead of an older shoe. Many times when you wear a shoe that's too old, it's going to lose the cushion and it's going to lose the stability side to side, and it's going to cause foot problems. Specifically, an old shoe can lead to developing a stress fracture. It can lead to plantar fasciitis, can lead to Achilles tendonitis. And the first thing when someone comes into the office, if we see that the shoe is over 6 months old, even though the shoe looks clean, it wears out. They actually make shoes to become obsolescent or obsolete. And that's why they do that. So if you look at the side of the shoe and you see little lines on the side, it's because the foam has worn out. The second thing I'd like you to do is to wear the proper shoe for the type of activity that you're doing. Many of our patients, they come in and let's say they're going to Disney and they're wearing flip-flops all day long. That's going to lead to a problem wearing a flip-flop all day when you're walking for miles and miles. I also find patients that they're doing the hardest type of work, like mowing their lawn and doing a lot of walking, and they're wearing their oldest sneakers. So you always want to get the proper type of shoe for the type of activity that you're doing. If you're doing playing tennis, for example, you want something that's very stable side to side. If you're doing a lot of walking, you can wear a sandal, but you have to make sure it's one that goes up along the ankle and gives you the most stability. So you have to really be careful of the type of shoe for the activity. For example, I have patients, let's say they're going to do skateboarding, or let's say they're going to play basketball. You tend to do better with something that goes up higher to give you more ankle support, like a hiking boot is made on purpose for a hiking boot. Or if you're working in a slippery surface, you want to find something that has a non-stick type of device on it. The next thing I want to talk a little bit about is this. There's a craze in people wearing minimalist shoes. Now, I'm a big advocate of minimalist shoes. In our office, we sell Lems shoes, and I like shoes that kind of feel like barefoot. The problem with a minimalist shoe, it's good for everyday activity. I wear it around the house. I do it for a little walking outdoors. But if you're going to do like a 3 or 5 mile walk, and if you're not used to it, it could lead you to developing a stress fracture. If you're going to do running in a minimal shoe, like the Vibram five finger shoes, where they have the almost like gloves that look like shoes, you want to be careful. If you're not used to it, it could lead to stress fractures and other types of problems in your foot. So you want to be careful. If you're getting into minimalist shoes, start wearing them, go slow, then start slowly running in them to make sure that you're not overloading your body. A good rule of thumb is increasing about 20% of activity per week. So it might take you a number of weeks to get into running, and you start with walking, and then you start with jogging, and you get into running with a minimalist type of a shoe. The other thing with a minimalist shoe, if you're used to wearing a shoe with a big heel and you go down to nothing, it could lead to plantar fasciitis and Achilles tendonitis because it puts more strain on the Achilles tendon. The other aspect of getting a proper shoe, there are many patients that think a Hoka shoe, which is one of those shoes that's really, really thick, is good for everything. Now, I do agree Hoka can be beneficial if you're having some pain in the front of the foot, if you're having plantar fasciitis. It's good because of the cushion, but it's also good because it has a nice arch support in it. But Hoka isn't good for everyone. There are certain patients, for example, that are older, that they have a hard time lifting up their feet and they can trip. I've had a couple of patients wearing a Hoka shoe. They hit the curb and they can trip with that. I have other patients that wear the Hoka shoes and they feel a little unstable because they're higher up, so they're at greater risk of fall. So if you have a fall risk and if you're not really that stable, a Hoka might not be the best shoe for you. And then the last aspect I want to talk about is wearing a sandal. Yearly, I see patients come in, they're wearing flip-flops and they're doing hard yard work, and they could injure their toenail. The toenail might come off, they might get a cut, they might get a sliver. So you have to be careful. Once again, I think flip-flops have their place. My favorite flip-flop is an UFO, but even that one has a few issues. The main issue with an UFO and other flip-flops is if your feet get wet or if they sweat, you're going to find that they become slippery, and this can cause other types of problems. So I've got these questions and a lot of other questions about how to pick the proper shoe, how to make sure it fits, and I put all these into my shoe buying guide. And if you want to learn more, I'm going to put a little link underneath here. You can get a link. You can get that shoe buying guide and what I call the foot patient treatment toolkit, which has all the treatments to help you get better with your foot condition.